So if it is hard for you to get pregnant without no cause, or you get miscarriages, it is possible that something called a Luteal phase defect is playing a role. It is a common condition that disrupts the menstrual cycle, and this condition occurs when a woman's ovaries does not produce or release enough progesterone, or the uterus lining does not respond to the progesterone that is being produced. So if anyone think she is experiencing some signs of this condition, of this Luteal phase defect, and you are trying to get pregnant, kindly seek fertility expert advice. You can also join us on our WhatsApp, where you can get more assistance in this aspect. Luteal phase defect, what is it? This phase is one of the phases of a menstrual cycle, because the menstrual cycle is categorized into 4 phases: the menstrual period, the follicular phase, ovulation, and the luteal phase. So, after menstruation has occurred, after ovulation, when your ovary releases an egg, and before your period starts, this is when this luteal phase comes in. So during the time, the lining of the uterus normally gets thicker to prepare for a possible pregnancy. So if one has a luteal phase defect, that lining does not grow properly each month. So this can make it more difficult to become or retain a pregnancy. What are the causes of this luteal phase defect? The luteal phase defects usually last about 12 to 14 days. During this time, the ovary make an hormone called progesterone, and this tells the lining of the uterus to grow. That is what this progesterone do. So when a woman gets pregnant, it begins to the developing baby will attach to this thickened lining of the uterus. But if pregnancy does not occur, the lining of the uterus definitely shed off, and you will have the period. A luteal phase defect can happen if the ovary does not release enough of this hormone, progesterone. Or it can also happen if the lining of the uterus does not respond to this hormone, progesterone, that is being produced by the ovary. This condition has been likened or linked to many health problems, like things like endometriosis, extreme amount of exercise, hyperprolactinemia, that is too much of a hormone that is responsible for making breast milk, obesity, polycystic ovarian syndrome, thyroid disorder. So many times, if you are able to treat this condition, you can correct your luteal phase defect. So what are those symptoms that you will be experiencing if you have this issue? When you have luteal phase defect, you will have problems such as more frequent periods, miscarriages, trouble getting pregnant, spotting between periods as well. In order for you to be able to diagnose this issue, a sample of your blood test can help to figure out what is happening, and also to check for the level of your hormone, especially the follicle stimulating hormone, the luteinizing hormone, and your progesterone. So these are the way you can be able to figure out if you are an individual be trying to get pregnant and you don't have any structural issues or anything that is holding you back. So go and find out how the length of your luteal phase. If the length is too short or too long, all this can also cause a problem. So do not forget to like and share this video to everyone out there. So thank you, and also follow us as well on our Facebook page, Dynamic Health and Wellness, where you can get more information about your health. Thank you and stay blessed. Bye.